Now you can start.
Yeah. Good evening, everybody. I'm welcoming all to our today evening's program. Even though our membership is low, we are starting the session, and I will continue the session. And then after that, Murthy today I don't expect Surendra sir to join us. So just give me a minute. I will start our lecture on digestion-related issues, digestion of food. Just take one. Can this slide be visible for all? Hello?
Yes, sir.
Yeah. Okay.
Yes.
Okay, digestion of food. We'll discuss about the digestion of food, how the food is digested and absorbed in our body. First of all, what is food? What is called food? Food consists of three main ingredients. That is, a proper balanced food contains three main ingredients, and that is one is carbohydrates, next is proteins, and the other ingredient is fat or lipids. Digestion is a term to refer the breakdown of the complex foodstuff to simple constituents with the help of digestive juices secreted by various parts of our digestive organs. So we have a digestive system, and the digestive system breaks down and absorbs the food in different stages with the help of various chemicals or secretions made by our body's various parts. So the broken down materials are easily absorbed by the body. So, like for example, we can say the food is broken down mechanically, physically or mechanically from the mouth. Mouth we chew and break it down into smaller pieces, and from the mouth, saliva works on it. There's a chemical called thionin in that in saliva, so that breaks down the carbohydrates first into maltose. So again, carbohydrates molecules are broken down in the mouth itself while we chew. So next is chemical digestion. Digestive enzymes are chemicals that break down large molecules of insoluble food molecules into smaller soluble molecules. So the chemicals will be used to break it down further. So that is chemical digestion. So carbohydrate digestion, we will see what is carbohydrate digestion. Food has carbohydrates in the form of starch and cellulose. Both are polysaccharides. Starch can be digested easily, but cellulose cannot be digested by the human intestinal secretions. Cellulose is again a polysaccharide, but it is too complex for the digestive enzymes to break down. So it will be useful as roughage. So if we eat a lot of cellulose, it will be used as roughage means it will form some sort of bulk in unabsorbed material inside the system, so that the intestine is stretched and there will be more surface area for absorption. So that is very much important. So just only what is required is not good enough for our system. Like that is why we say when we eat maida is pure starch. When we eat maida, there is no fiber in that, and the intestine will not have the power to expand further and absorb it more, and all these materials will get stuck in that, and that is why we call maida is bad. The refined flour is bad. So same way, if you eat fruits and vegetables together along with that, the cellulose in that will stretch the intestine properly, and we will have good absorption and good bowel movements will happen. So roughage is important, and it is important to effectively absorb the food and remove the unwanted materials from the intestine. So disaccharides. Disaccharides means saccharides is sugar molecules, sugar complex sugar molecules, and di means two. So sucrose and maltose are the sugars for example, which are examples of disaccharides. Sucrose is like the common sugar, the cane sugar what we have, and maltose is the malt sugar that is These are broken down into monosaccharides like glucose and fructose by enzymatic reactions. So monosaccharides are glucose and fructose. So sucrose and maltose are broken down into monosaccharides like glucose and fructose by the digestive juices. So carbohydrate digestion, the first part, which is the disaccharides, that is broken down to monosaccharides. So digestion of starch. Cooked starch is digested in the mouth by an amylase enzyme. That is, amylase is the protein, this is the starch digesting enzyme, and in the saliva called ptyalin or salivary amylase. So when you chew from the cooked starch, you can feel there is a sweetness for that starch what you eat. That is because the sugar is getting released in the mouth, and that is because of the ptyalin or salivary enzyme. So salivary amylase. In the intestine, pancreatic amylase breaks down both cooked and raw starch into maltose. So if you don't cook starch, then it will be working from inside the stomach. And like pancreatic amylase will break down the cooked starch into maltose. Pancreatic amylase is absent in infants up to 6 months of age. So if you give infants uncooked raw starch, they will not be able to digest it. That's why we don't give solid food till 6 months for infants. This is the reason. So 6 months, after 6 months, they will have amylase and they can digest all type of carbohydrates. So what will happen in the mouth is grinding of the bolus, that is a food ball by the teeth. It's called mechanical digestion. Then the salivary glands produce saliva, and then the enzymatic digestion in the mouth itself. Saliva contains salivary amylase, and starch will be converted to maltose. Salivary amylase will break down the complex starch into monosaccharides. So what happens for the food inside the stomach? The acid, the hydrochloric acid in the stomach, and plus pepsin enzyme, as it's called gastric juices, will start chemical digestion of proteins, and from there, due to muscular contractions, there will be mixing of all the things, and mechanical digestion also will happen inside the stomach. So digestion of disaccharides. So there are no action, or there is no action on disaccharides in the mouth. So in the mouth there is no digestion of disaccharides. In the stomach, gastric hydrochloric acid and will hydrolyze the sugars. So hydrolyze means it breaks down the sugars. Pancreatic juice also has enzymes like maltase, lactase, and sucrase. So based on whatever the names are, the age means breaking down. So maltase breaks down maltose to glucose, lactase breaks down lactose to glucose and galactose, sucrase breaks down sucrose to glucose and fructose. So this is how why the pancreas is important, because the pancreatic juices are very much important for digesting starch or complex disaccharides. So digestion of starch, starch will be broken down by salivary amylase or ptyalin to maltose, and then there is no digestion further for maltose inside. Then with the pancreatic enzymes, maltose from the ileum will be broken down into glucose. In the stomach, maltose remains as maltose. Digestion of proteins. Main protein content in the food are albumin and globulins. So in the food we have albumin and globulins, which are the main proteins, and also caseinogin from milk. Mucin and collagen will also be a part of the protein contents in the food. So main is the albumins and globulins what we eat, and then caseinogins from the milk, mucins and collagens from the seed foods and all the seeds, and seeds what we eat. So furthermore, 50 grams of protein is delivered daily. This is interesting. Everybody should remember this. More than about 50 grams of protein is delivered daily from the desquamated cells and gastric intestinal secretions. So intestinal secretion also contains protein, and the skin of the internal lining of the stomach. will also be broken down. And desquamation means removing the cells falling off, dead cells falling off into the system. Those also will be digested from the body, and it's called desquamated cells. Totally, those secretions and desquamated cells form 50 grams of proteins, which will be recycled back to the system. So the process of protein digestion is carried out by the by the endopeptidase. Like the protein digestion is carried out by peptidases like pepsin, renin, trypsin in the gastric and pancreatic juice, and chymotrypsin, and break the polypeptides to di or tripeptides. So the polypeptide will be more than five peptide molecules, protein molecules, so combined together, and when it is reacted upon by the pancreatic juice and the gastric juice and the chymotrypsin, they break down the polypeptides to dipeptide or tripeptide. The exopeptidase is an intestinal juice converts these lower peptides. So these di and tripeptides will be broken down into amino acids. The amino acids are absorbed into the blood and transported to the liver. So this is how the protein will be digested. So you can see this will be polypeptides, and by digestion will break down them into peptides, and polypeptides and peptides will be broken down into amino acids by peptidase enzymes. So proteins will be broken down by polypeptides. So renin is an enzyme that is found in the stomach of young children. Renin is an enzyme found in the stomach of young children. The function of renin is the soluble protein in the milk will be there, and it will be broken down into insoluble protein, changed to insoluble protein. Pepsin then acts on the insoluble protein. So renin works on that way. It will be milk protein will be water soluble. It will be changed into insoluble protein, and pepsin then acts on the insoluble protein and breaks it down into further amino acids. So gastric juice contains hydrochloric acid, pepsin, and renin. So that is the breakup of the gastric juice. So three enzymes in the pancreatic juice are pancreatic amylase, trypsin, and lipase. The action of each enzyme is like the fat digestion. Fat digestion starts in the mouth with a lingual lipase. This lipase breaks down some sort of chain lipids to diglycerides. So the long chain lipids are broken to diglycerides by the lingual lipase. The lipase is inside the saliva. And when the food with the lipids reaches the small intestine, it stimulates hormones which trigger the release of pancreatic lipase and bile from the liver too. So liver also, when these diglycerides reach into the stomach, the pancreatic lipase is secreted and bile also will be secreted. These emulsify the fat and makes it easy to break it down. So the large molecules of fat will be broken down into diglycerides, and bile and pancreatic lipase emulsifies them and break it down into further molecules. So bile salts emulsifies fat, that is, break down large fat globules into smaller globules. What is the benefit of emulsification? The surface area of the surface area where lipase can act is increased. So if it's a big ball, the area will be less, and if that ball is broken down into many small balls, then the surface area where the enzymes can act will be more, and that's how the digestion happens quickly. So like you can see, a big ball is broken down into smaller balls, and when there's smaller balls, the surface area for interaction will be more, and bile salts prevent the small droplets to come back again to form a large ball again. So that's called emulsification of fat. So digestion of fat is like the clumped fat, the large one is separated into smaller fat molecules, and then it is broken down by enzymes into fatty acids. Fats are digested and further broken down into fatty acids and glycerol. These are absorbed as such. So fatty acids and glycerol is not broken down further. It is being absorbed as such by the lacteals of intestinal villi. We have seen the structure of intestinal villi earlier, and there is a lacteals which will be blood vessel charged center part of the villi that will be absorbing the glycerol and fatty acids directly and will be transported via lymph vessels to the bloodstream, which will reach the liver for further processing. This the structure of and details of the intestinal villi can be seen again. So this is how it is. So the villi is the proportion of the intestine wall, and it will be richly supplied by blood vessels. And the center of that is a lymphatic portion that's called lacteal, and lacteals will be absorbing the glycerol and fatty acids, and will be sent to the liver by using the lymphatic transport system. So there are three types of the picture diagram of the three types of food. Starch molecule with amylase will break down to maltose. Proteins, polypeptides, the multi-chain proteins, with the trypsin, it will be broken down to peptides. And fat molecules with the action of lipase will be broken down to glycerol and fatty acids. And these are the final or end products. All milk products which will be further broken down by other enzymes to glucose and other end products. Peptides will be broken down to fatty acids, will be what we call amino acids, and fat will be broken down to fatty acids and glycerol. So now enzymes in the intestinal juice will be we can say the substrate. Enzyme and end product, you can say peptides is the substrate, peptidase is the enzyme, and amino acid will be the end product. For lipids, lipase is the enzyme, fatty acid and glycerol. For maltose, maltase is the enzyme, and glucose and it is broken down to glucose and glucose. The two molecules of glucose makes maltose. So sucrase is the enzyme, and it will have one glucose molecule and one fructose molecule. Lactose will have lactase as the enzyme. Glucose and galactose will be the end product of digestion of lactose. So this is all as a small reminder type of brushing through on the digestion part, and my discussion on food digestion is over now. We'll pass it on to Muthu sir. Muthu sir, you can continue.
Is my voice audible, sir?
Yes, sir.
Okay. Namaste, my dear homeopaths. Our Anup Kumar sir has taken about digestion problems and how it will digest and everything. For that, in our homeopathy, we are having excellent medicines. Sir, with your permission, I will continue in homeopathy. Your digestion, huh? Anup sir.
Please continue, sir. Please continue.
I will continue in homeopathy way.
Sure.
Generally, when we are taking the fats and everything, fatty foods, fats and junk foods like that, everything, whatever it is there, our traditional, other than our traditional food, whatever we are taking in our body, biliousness will be there. It is nothing but a nauseating thing, always nausea. So these people generally they will suffer from slight headache, mild and moderate headache. They will balance with that. But if it crosses their limit only, they have to suffer a lot and they will take medicines. Till that they will manage. Nowadays, every human being, 99.99% of the human beings are having certain diseases in their body. Thanks a lot to the modern technology, they are bringing some papers as a reports and they are telling you are having these type of diseases in your body. So these types of medicines you have to take. So these people mentally they are accustomed to that type of treatment. So everybody, so many people are coming to us and they will tell, sir, I am so and so, my name is Ananta Padmanabhamurthy, I am IBS. As it IAS or IPS. IBS is irritable bowel syndrome. Like that everybody, I am having indigestion, I am having gastric trouble, I am having GERD, GERD, I am having gastritis. See, whatever you tell, I am having migraine. So everybody, nobody is telling I am totally healthy and happy. They are happy with the disease. Out in the community or in the gathering itself, if you ask anybody, everybody tell I will take, but they will have certain type of pills either in any therapy, preferably in allopathy, one tablet they will take every day. It is starting from the birth time itself. Previously, in my younger days, generally after birth, the children will be given for 3 months or 4 months Abdec drops, A, B, C, D, Abdec, A, B, D, E, C. That is a multivitamins for children drops. So after that, they will give some digestion things, or some water or like that, body salt, something like that. After that, after another 10 to 15 years, no medicines for children. They will simply eat in the house several times, they will play. They will follow parents or elders' advices. Nowadays, no elders, no parents, nothing, only WhatsApp is telling and computer is telling or Google is telling. They are following that one. Even a doctor prescribes a medicine also, these people are going to Google and they will search that one, this medicine is suitable to me or not. They have paid a lot to the doctors. Even then they will go to Google and they will search that one whether the medicine is correct or not, or any substitute for that. So nowadays the system is going on like that. Every person mentally they are prepared, I am having a disease, I have to take these medicines. Without medicine nobody is working. So with this generally biliousness will be there for everybody. This is nothing but a nausea every time. Now no problem with nausea. Every day whenever you are brushing, twice a day or single time a day, at that time you put in the middle finger inside your mouth near throat and you bring it out, whatever the phlegm is there, slight phlegm and glary mucus will be there, that you have to spit. In the previous days when we are having neem sticks are there, at that time the people will do. After that powders have come. Even powders time also we will with finger itself we will clean our teeth and we will gargle and everything we will do. Nowadays nothing, no tongue cleaners also. And even shops also, if you ask tongue cleaner, what is the tongue cleaner? Because everybody is having brush, backside certain marks will be there, with that they are cleaning tongue. So with this, morning to evening, they will dump something in their mouth. So what will happen? So natural digestion will spoil. Natural enzymes will be spoiled. So zigzag enzymes will come. With these zigzag enzymes, people are living. They will take so many medicines, company, you won't believe, thousands companies are there, antacids they are preparing, and digestive problems they are, digestion tablets they are preparing, something or other, either doctor prescribed or Google has told or some friend has told or some WhatsApp has told, they will take. Jumping from medicine to medicine, jumping from therapy to therapy is a fashion of the day. So how our stomach will be set right? How will be healthy? No. See, God has given an expiry date for us. Till that expiry date, we have to protect our health. Who is doing that one? Nobody is doing that one. So, now, see, what is your traditional food? What your forefathers has taken, what your fathers has taken, what your other people in your community, what are the things that only you have to follow. Not the latest junk foods are like that. They will name so many things, pizzas, pizza. You can take it occasionally, not regularly. Say wheat eating persons will be there, you have to take wheat eating only. Rice eating persons will be there, they have to take rice only. So I will not take rice, I will not take millets, I will not take that one. Doctor has told this much only, 50 ml of water only I will take, 100 ml of juice only I will take. No, these things we have to reduce. What were from forefathers onwards we are taking, you take less. Because nowadays nobody is walking, nobody is doing any physical exercise. So you are sitting in a chair under a AC. So with that some problems will come. So you will reduce your eating, quantity wise you reduce, not quality wise. So as far as medicines is concerned, because of this biliousness control, we are having an excellent medicine, Cardus Mariana. And it is a liver spleen remedy. So liver and spleen and pancreas, these three things are okay in our body, means our digestion problems roughly 70% will be reduced. After that, chelidonium is there. This is also one of the best remedy. It will protect our liver. And iris sphere, one of the best remedy. Whenever you are feeling a sore and bitter eructations from your mouth, at that time iris swell and ipecac, these two drugs you can take as and when you require. These are very, very small remedies. With this, we can manage the entire our life. Only thing, morning should not be, there should not be any constipation. Bowel movement must be excellent. As per your age, suppose you are a 70 years, I am a 70 years, means at least 70% my bowel movement must be there. Because I am 70. 100% bowel movement may not be there. Because no physical exercise. Like that, bowel movement must be there. You have to cook, you have to take plenty of water, minimum exercise you have to do, and bowel movement will be natural. Otherwise, you can take in the proper vegetables and fruits that will make you bowel movement proper. Once bowel movement is perfect, then appetite will be okay. Without bowel movement proper, appetite will not be there. Without appetite, if you dump something in the stomach will upset. With that upset stomach, at 3 o'clock one medicine, 4 o'clock one medicine, 6 o'clock one medicine, even night sleep will not be there. So when your bowel movement is okay, your appetite will be okay. When your appetite is okay, whatever you are taking inside to the stomach, that will be digested according to the nature. It may be 3 hours or 4 hours or 5 hours, as per the constitution as per the body. Afterwards, whatever you are having tea or coffee habits, that you can take internally, morning once and evening once. Night around 7 o'clock you have to take your food. That is must. Nowadays people are taking up at the midnight 12. When it will digest, when the bowel movement will be there, when again appetite will come, when the digestion will be there. So the process has entirely gone to dogs. So our system, we ourselves is spoiling. So only thing, at least from tomorrow onwards, everybody, little, I am not telling 100% you have to follow like this. Bowel movement must be there properly. Minimum 70 to 80%. For that, whatever we naturally we have to get, that you have to do. You can take medicines, not permanently. Afterwards, appetite. Appetite means you take hot waters. Instead of cool water or ice water, you take hot waters. Naturally, appetite will be there. Afterwards, you take some leafy vegetables. Vegetables, preferably leafy vegetables. And whatever the food is available cooking in our house, that you have to take. That too, preferably 70 to 80% of the stomach only you have to take, not 100%. You want to take nap or some sleep in the afternoon, you can take 1 or 2 hours. Doesn't matter. Because this age, after 60 years, we have to take some sleep. Afterwards, 4 o'clock, some snacks, which is very, very less, 10 to 20% snacks only. Because of snack and solely, you should not take a packet of biscuits. Only 1 or 2 biscuits with tea or coffee, whatever it may be. By 7 o'clock, you take some little food and vegetables, fruits. Most important. This is the thing. Automatically, you will get your sleep at around 10 o'clock or at 9 o'clock, whatever it may be, 11 o'clock, you will get your sleep. Sleeping early and getting up in the morning early will make your health perfect. You will not get anything. Because nowadays, actually today I want to take cough and throat I want to take. Because nowadays, entire in Chennai, because of the horrible pollution and water is not proper, all contaminated water. So viral infections are coming frequently to everybody. We are treating, within 15 days again he is coming. Within 1 month he is going to antibiotics. Every month they are taking antibiotics for 5 days. Because they are coming, some disease is coming, they are going to doctors, they are not checking, testing. So with tests, they will spend 6,000 or 7,000. With the test, they will give another 5 days of antibiotics. Nobody is giving multivitamins or B complex or whatever it may be. This is a course, this is a cycle for them. After they are coming to us, we have to treat properly. Because 5 days they have taken, the disease has been reduced to certain extent, but side effects have come. With that side effects, they are coming to us. When we are giving for 10 days or 15 days or 20 days, sir, what is this much? Within 3 days, can it be possible? How it will be possible? You have spoiled a lot because of your habits, because of your intake, because you are so many things. Everybody wants within minutes the disease will be reduced. But they are exercising months together, dumping their stomach. The stomach is creating all problems, all types of physical problems. So what we are getting now, diseases are self-acquired diseases. Self-acquired disease, as if we are purchasing from a shop one razor or our blade or whatever it may be. Like that we are purchasing diseases because of our habits. So early sleep, early waking up, bowel movement proper, appetite increase, digestion increase, and indigestion will not be there, and pleasant sleep will be there. This procedure if you follow, I think 70 to 80% everybody will be cured with the minimum medicines. That too, that medicines which are available in the market, previously what doctors has prescribed. Suppose one antacid is there, or Gelusil or whatever it may be. That if at all, if you want, you take that one only. Latest drugs don't take. Because latest drugs temporarily it will relieve only, it will not permanently cure. Whenever you are having, you can take paracetamol, nothing but. More than that, don't go anywhere. If it is abnormal, even paracetamol also not reduced your disease means, then you have to go to doctor and take proper care. That also, whoever the doctor regularly seeing you, that only you have to take. Like that, you should not change a lawyer, you should not change a doctor, you should not any trouble in my speech. Are you listening this one? Is my voice audible?
Yes sir, yes sir.
Blinking is coming in my okay. Some blinking is coming. So you must be follow this one. The medicines are available when biliousness is there, your liver is not properly working means you are having Cordus Mariana, Chelidonium, Irisware. These three drugs are most important for you. And after that, you are having Abies nigra. Indigestible substance is there in the stomach. If you feel indigestible substance is there in the body, at that time Abies nigra will be there. This is meant for, Abies nigra is meant for esophagitis, that is called GERD, GERD or esophagitis. For this, some people will tell without mentioning the name, I am having tightness in the middle of the chest and I am unable to, erections are not coming, I am uneasy, every day I am feeling uneasy. At this time, Abies nigra will work. After that, you will have an Argentine nitricum. This is also one of the best drug for GERD, and this is also one of the best drug for esophagitis. Antimonium crudum. This is one of the best remedy nowadays. What the entire lecture I have given now for that antimonium crudum, because morning to evening the mouth will not keep quiet. Something or other it will go inside. At that time antimonium crudum will be there. Antimonium crudum symptom is when you ask the patient to open his mouth and show the tongue will be just like a white paint will be there. Same symptom is there in natrum phos also. So antimonium crudum is one of the best drug. Because of overeating or because of undigestible food particles in stomach continuously, naturally the persons will get prone to joint pains. For them also antimonium crudum will work. So antimonium crudum not only it will work for the stomach, it will work for joint pains also. A persons who are having constantly joint pains means antimonium crudum. Depending upon other symptoms, tally means you can give. And next one, arsenic album. Pretty well you know. I need not tell that one. It is a gastric, catarrh, the calling, stomach pain, stomach upset, and food poison for everything. Arsenicum album will be there. And one of the thing, asafoetida. It is other than nothing but Hind. I think in Hindi they will call Hind. Asafoetida. This is also one of the best thing. Whatever fat foods you are taking, at that time asafoetida will work. Asafoetida, carbovage, natrum phos. These type of medicines you can take. Afterwards, bryonia. Dry mouth will be there. Frequent water has to take like that. And next, carbovage. It is one of the best remedy. It will release the carbon dioxide and oxygen will go automatically inside. And chamomilla, when abnormal stomach pain is there, unbearable stomach pain is there, chamomilla you can take. And Sina, when worms are there, CINA, Sina, when worms are there, to get rid of worms, you can give Sina, Teucrium maramviram and natrum phos. These three medicines minimum 15 days you have to give. Then 70 to 80% of the worms will be eradicated. Next, colchicum, abnormal appetite will be there, but after seeing the food, he will get nausea. At that time, colchicum we have to give. Colchicum is one of the best remedy for joint pains, that too preferably gout, G-O-U-T. Colocynth, it is also one of the best drug for stomach pain. The stomach pain will be reduced by bending double, that is bending forward, stomach pain will be reduced, or with hand if you push inside the stomach, at that time also stomach pain will reduce. That if that symptom is there, colocynth is one of the best remedy. Next, ipecac, I have told already, it is a continuous nausea will be there, continuously nausea will be there. And calibricum, periodical headache will be there, and after 1 hour stomach pain will come, calibric. And this is one of the best remedy. Whenever you eat, more phlegm will be coming from the throat. At that time, calibric will work excellently. And lobelia, acidity in stomach, and because of this acidity stomach, gas will push upside nearer to diaphragm. So these persons will have some chest congestion. So chest congestion will be there and chest tightness will be there. At that time, lobelia along with asafoetida, one of the best remedy. And lycopodium, derangement of stomach, and gas will not go downwards. So lycopodium is also one of the drugs. All these drugs we have mentioned everywhere. And natral sulf, I told tongue will be white and lactic acid will be more. Like at that time, natrum fast, preferably 6x. Daily if you take morning 4 pills and evening 4 pills, your stomach will be set right within 15 days. Next, one of the best remedy is pulsatilla, tongue coated with mucus, and frequent nasal problems will be there. And whatever the pastry food will not work for these people. And I don't know what is that in our oily food, it will create a problem. At that time, pulsatilla we take. Pulsatilla is one of the best remedy for digestion by taking pastry food or undigestible food, heavy food. And Nux vomica, last medicine, this is one of the best remedy where the people erratic food habits. For those erratic food habits, Nux vomica is one of the best remedy. Nux vomica you can give continuously 10 to 15 days, preferably night. Daytime also it will work. Preferably night means at a reforcing period, Nux vomica will work excellently. With this, our what Anup Kumar has started the digestive problems. For that, homeopathy wise I have given. With this, I think my lecture is over. Suresh Kumar sir. Hello, Suresh Kumar sir.
Yes,
Yes. Thank you very much, sir.
thank you, sir.
Shall I?
Yeah, please go ahead, sir.
It's audible?
Yes, sir. Your voice is audible.
Yes, sir.
Yes. Good evening to all participants in this group. We were discussing about the topic selection of potency. In the last class, I talked about the selection of potency with reference to constitution and temperaments, where I said that, to summarize, for sensitive people, usually it is higher potency used, particularly in case of nervous type of people, and then intelligent people and intellectuals, people impulsive in character, sanguine character temperament people, and people very quick to act and react. Such type of people require higher potencies, whereas the lower type of potencies, particularly phlegmatic temperaments and nervous temperaments, and dull people, very slow to act, and sluggish people with gross habits, then people with high muscular power, great muscular powers. These people, these type of constitutions, they will require lower potencies. So with this, we saw the last class. Today we will continue the further parameters or the factors which we require to analyze. Factors in relation to the symptoms. We will see what we should look into the symptoms to assess or come to conclusion about the potency selection. So the prescription made by mental symptoms. When clinical cases, the mental symptoms are categorized, classified first, and then the physical symptoms are being classified later on. So in your case taking, it should be two parts, one mental symptoms, the other part should consist of physical symptoms. So whenever there are more mental symptoms, the remedy should cover the higher in potency. So higher potency applicability will be used or when employed when there is a larger mental symptoms are there visualized. Then point number 2 is degree of similarity and characteristics symptoms present in the case. Closer the similarity of the symptoms with then the higher potency, what's called closer the symptom similarity with the characteristic symptoms, then higher potency may be employed, higher potency may be used. Even with more similarity of the symptoms with peculiar, prior, and rare and striking symptoms, as well as the totality of symptoms, TOS, the higher potency can be employed. So this is another rule or guideline which has been given with reference to symptoms. That is, more the symptom similarity, larger symptoms are matched, then we can go higher potency. Or if we have a more visible characteristic symptoms like PQRS, that is PQRS the formula or the principle of characteristic symptoms being projected, that is P is peculiar, Q is prior, and R is rare, S is striking. If such type of symptoms are present in the clinical cases, then we can go for higher potency. And whenever your totality of symptoms is also matching, definitely we can go for a higher potency, higher in our ladder of potency. So these are with reference to characteristic symptoms and their matching in the potency scale. Then coming to next important factor is with the relation to disease. We are seen with the mental symptom, now we are seen with the characteristic symptoms. Now we will see the nature of the disease, how potency selection is to be done. So let's take with acute diseases. In acute diseases, there is no structural changes is usually affected in such cases. Naturally, the susceptibility of the patient remains very high. Moreover, there is a sudden onset, there will be rapid progress, and more or less fixed duration of the disease. Example, chickenpox, measles, influenza, whooping cough, meningitis, common cold. These are the examples of the acute class. They require higher potency. Here, repeated doses of higher potencies are effective to arrest the progress of the disease. So, the first thumb rule or the guideline is given in acute diseases. Whenever there is no structural changes there, obviously the susceptibility in the organism or in the body will be very high, and that's why in acute state we are allowed to use high potency, or even high potency. The liberty is also given to repetition of the higher potency. Then coming to next type of acute diseases. Acute diseases with lowered vitality. When there is acute disease with lower vitality, particularly in case of severe dehydration, example diarrhea and vomiting, shock, collapse, extreme prostration, severe bleeding, excessive bleeding, typhoid-like condition state, then in that scenario, it has been advised to use lower potencies in repeated dosage can be also used to overcome the inhibitory state of the vital dynamics. Here, preferable potencies are 3, 6, 12, and 30. So this is about the acute disease and with lower vitality. So as a rule, it has been advised by masters that in acute diseases, wherever the lower vitality is being observed or perceived, please adhere to the low potency 3, 6, 12 and maximum up to 30. So this is about the acute disease with low vitality. Then the third type, acute manifestation of chronic disease. The chronic diseases also have acute flare-ups. So they also can be identified as acute diseases. So acute manifestation of the chronic disease. So it can be again bifurcated into two categories with gross organic change and beginning of the organic change. So with gross organic change, they require always low and medium potencies. And whenever the case acute flare-up with the chronic disease is perceived with the beginning of the early stage of the organic change at the functional plane, then we are allowed to use higher potencies. So this is the thumb rule with acute disease, acute flare-ups in chronic diseases. So whenever you see the gross changes, you use a low potency and medium potency. Or whenever there is a beginning of the organic change or there is a larger functional derangements are being observed, there you go to the higher potency. This is the advice given by our masters. So this is all with reference to acute diseases. Now chronic diseases. Next segment with reference to disease is the chronic disease. So chronic disease, first we will take up as a without gross organic change. So whenever in a chronic disease there is no grosser organic changes are being observed, then higher potencies, they act as a curative if given as a single dose or also repeated dose. Example, in case of a migraine, neuralgia, neurosis, then in case of paralysis also. So very early stages when there is a gross pathology is very beginning and very early stage, then in such conditions or in such cases, it is advised by masters to go for higher potency as a single dose. And if necessary and need, we can repeat it. Then chronic disease with gross organic change. As the susceptibility becomes gradually low because of the long continued suffering and organic changes, low and medium potencies will be advised here. Too low potencies, if we repeat in dosage, even in organic chronic diseases, there may lead to Kent's 10th observation. So we have already seen 10th observation. There it is being said that new symptoms will appear in the remedies. So in such, the masters say that too low potencies, even frequent repetitions, can lead to 10th observation of the Kent. So that we have to be very careful. Then if we are using too high potencies also in comparison to the patient's susceptibility, then there may be possibility of Kent's third observation visualized. What is Kent's third observation? The third observation that aggravation is quick, short, and strong with rapid improvement in the patient. And the patient may have to pass through this grievous suffering before the cure take place. So we have to be very careful in case of wherever the gross organic changes is there, then we have to judiciously use the low and medium potencies. That is advice given by the masters. Then in case of mental diseases, the susceptibility is very high, generally very high, but high potencies are contraindicated in such cases to start with, and because of the possibility of too violent aggravation. So in mental diseases, though the susceptibility is very high, it has been advised by the masters that please don't go for higher potencies. We start with the what's called medium potencies or low potencies, because there may be chances of a violent aggravation also. So particularly in case of when we take up the cases of the fits, convulsions, like that cases where the mental disease is very predominantly very high and intensity of the symptom is very high, in such cases we should not go very high in potency, and we should keep ourselves near 30 and below, so that in the patient this violent aggravation should be prevented. So in case of mental diseases, even though the susceptibility is very high, the masters advise us to be in the lower potencies. This is all about the chronic diseases, the advice being given by our masters. Then next is difficult and incurable diseases. In this scenario, what advice is being given? Let's see also. The patient with difficult and incurable diseases will avoid severe aggravation and great palliation of their symptoms and prolonging of their life if the physician prescribes remedies of more superficial nature and in potencies not about 30th and 200. So here, in case of incurable cases, very difficult cases, the masters or our organon, they suggest go for 30th or at the most maximum 200. Don't go beyond 200. There's been advised. Or Dr. Hahnemann, having used the 50 millismol potency scale, there is a scale used by Dr. Hahnemann. We'll see that also in next when this particular chapter comes. So there is a 1 decimal scale, 1 centesimal scale, then another is a millismol scale. So in case such scenarios, in case of incurable cases, the 50 millismol potency may be also used for best purpose. So in curable cases, we can use low potency, not beyond 200, and also the 50 millismol scale of potencies. This has been advised by Dr. Hahnemann. So this is about the difficult and incurable cases. Then intensity of the disease. After seeing the type of disease, acute disease, chronic disease, incurable disease, let's go to the intensity of the disease. So certain malignant and rapidly fatal disease like cholera. So example given is cholera may require material dosing or lower potencies of indicated medicine. So later on, the potency can be changed to higher one if necessary, and if can be repetition is required. So in case of certain malignant and rapidly fatal disease, it has been advised to use low potency and slowly go to the higher in scale, higher in order. So this is about the intensity of the disease. Then coming to the next important point is seat of the disease. Seat of the disease, where the important viscous, that is an internal organ, has been considerably deteriorated, then material doses of medicine are necessary to check it. So this naturally belongs to chronic cases. That is in case of, one example I can give you, ischemic heart disease, where the muscular layer or heart cells are being damaged because of the extreme low oxygen supply to the muscles of the heart muscles. So in such scenarios, we have to use the what's called lower potencies, and later on we can go into higher in our potency scale. So in case of necessity, so in case of seat of the disease, very important that where the disease is located, where disease is being observed, in which organ, where, and what damage it has caused. I have given an example of the ischemic heart disease, where we have to use the lower potencies of it. Later on, when the improvement is observed, then we can go a little higher in scale. But to start with, we have to adapt with the lower potencies. So again, particularly in case of liver, particularly in case of the spleen, and in such scenario, we have to always adapt to the low potencies also. So in case of ischemic heart disease, we give cactus also. In case of spongiatosta also, we have been prescribing in dilution. So in such important parts of the body, wherever there is a organ related damages are occurred, organ related irregularity, or the what is called pathology is being observed, then it is always better to be in a lower scale of potencies. So seat of disease is very important in selection of the potency. Then another important aspect we have to see is the previous treatment of the disease taken. So many patients come to us with the treatment taken in other system of science, or other even people come with homeopathic treatment taken from other physicians. So patients who have taken many crude drugs in homeopathy or in allopathic system, often they can be used with either antidotes. We can use antidotes to neutralize those crude impact of the drug, or you can use higher potency of the drug in advice has been given. So whenever the patient come with the impact of the crude drugs of the homeopathy or allopathy, there we can use either antidotes or we can use higher potencies. So this is about the seat of the disease as well as the previous treatment taken, and then the line of action to be taken in such situation. Then coming to the another aspect in selection of potency, stage or pathological condition of the disease. Again, this is also important, pathological condition of the disease. So disease process manifested in two stages. One is called dynamic pathology, the another is called organic pathology. That we have to keep in mind. Pathology, dynamic pathology, the other is organic pathology. So dynamic pathology denotes stage from very beginning of the disease till structural changes start. During this period, only functional disturbance occur, so susceptibility of the patient will be very high, and in such kind of chronic diseases, it should be treated with a higher potency. So in case of a dynamic pathology exhibited, then we are advised to give higher potency. But on the other hand, when organic pathology is denoted, that is from the stage of the beginning stage to the structural changes, that is end stage of the disease, when such scenario is being observed, during that period, the susceptibility of the patient will be very, very low. Hence, as such, the potency also should be low. Selection of potency should be also low. So the advice given here is, whenever there is a dynamic pathology exhibited, go for the higher potency, or whenever the organic pathology is being observed, go for the lower potency. Then coming to important aspect, another important aspect in selection of the remedies, that is called miasmatic state. different miasmatic state that can be to be observed in case of potency selection. The primary manifestation of SORA, psychosis, and syphilis, they require higher potency in repeated dosage or large dosage also. But wherever the secondary manifestation of the different miasmatic state is been observed, there the low potency and medium potency has to be employed. I have already taken class in SORA, psychosis, and syphilis long back, where I have classified them into two categories, primary and secondary category. So here the guideline is being given, wherever the primary manifestation of this SORA, psychosis, and syphilis has been observed, use higher potencies, and wherever the secondary manifestation of the miasmatic states have been observed, go for the lower potency or the medium potency. So this is the guideline given in case of a miasmatic state. So coming next important parameter in selection of remedy is nature of the medicine. The nature of medicine also has a great role to play in selection of potency. No source. The no source group, how to select? No source group of the medicine should be always administered in higher potencies for its correct effect or true effect. So no source are always given 200 and above. So this is the guideline given here. Some medicines work best in low potency or tincture. We have already seen, and Dr. Murthy in many circumstances in his therapeutic lectures, he has always been kind enough to tell about the lower potencies also. So some medicines, they very well work in lower potencies as well as in tinctures. Example, Crataegus. Particularly, it is to be given in mother tincture whenever the valvular heart disease are present or ischemic heart disease are present. So mother tincture of Crataegus is used in such scenario. Then coming to Sabal ceruleta. Sabal ceruleta, the lower potencies or the mother tincture is very well given in BHP. The expansion of BHP is benign hypertrophy of the prostate. So whenever you come across hypertrophy of a prostate, always we go with a low potency in Sabal ceruleta, preferably mother tincture. Then whenever the spleen is affected, pathology is observed in the spleen, then we go for Schwannothus. Schwannothus is another remedy, mother tincture format, a low potency is given in case of a spleen enlargement. Wherever the enlargement of spleen is observed, we go with Schwannothus remedy in lower potency. Then in case of hepatitis, when liver is injured, badly injured, so we go for Chelidonium mother tincture in lower potencies. Then we go for Arsenicum iodatum in low potencies in case of influenza. Whenever the influenza is there, we use arsenic iode in lower potency. Then in case of thyroid issues, calcarea iode is used in lower potencies, 3x, 6s, 6 like that. Calcarea iode is used in case of thyroid deficiency or thyroid diseases. Then we use Berberis vulgaris in case of whenever gallstone is being observed, or whenever we see the lithiasis in kidney, wherever the stones are being observed in gallstone and bladder or kidney, then obviously Berberis vulgaris in low potency is used. Then in case of gallstone, we use lower potency of Chelidonium also. So these are the guideline. That is, some medicines when used in low potencies, when used as a mother tinctures, they have a greater efficacy in eradication of the or bringing a cure. So I have taken mother tincture classes also, given the notes also. You can refer also wherever in what process stages or when the organic changes have happened. In that scenario, the lower potencies of mother tinctures can be applied. Then some medicines, another point in selection of medicine, effect of some medicines varies with the potency also. With some medicines, their effect is repeated to vary with the potency used. Example, heparsol. I will take a best example as heparsol. Heparsol in lower potency hastens the suppuration, whereas the higher potency aborts the case. So this is a very good example that effect of the medicine varies with the potency also. So that we have to also keep. When we use, in what circumstances heparsol should be used in a lower potency and what circumstances in higher potency also. So this is also we have to keep in mind while selection of the remedy also. Then certain prescriptions, certain type of prescription with deep acting medicines in serious chronic diseases. That some guidelines have been given, some footnotes have been given by masters. That also we have to keep in track, we have to keep in mind. Then while prescription is made for the deep acting remedies, particularly in chronic diseases, then we have to take a greater care and in case of chronic disease. I will give some few examples like Lachesis 200. Lachesis 200 has to be carefully used. It has got a Dr. M.L. Taylor, the famous master of homeopathy. Dr. M.L. Taylor said that whenever you perceive, because there is greater chance of having unpleasantness with Lachesis 200. So when M.L. Taylor has said that be careful in using Lachesis 200. And she has also, M.L. Taylor has also suggested, whenever you see the unpleasant effect of the Lachesis 200, please antidote with sepia. A dose of sepia, please antidote with that. So that masters have also said also the caution to be taken care. Then some drugs in 200 is a weekend, particularly lycopodium. Okay, Dr. M.L. Taylor, she has been very sharp in assessing the there's a negative effect or that's called effect of in case of the chronic disease. So she advises, M.L. Taylor advises that please use lycopodium 200 very carefully, because they also have got a greater danger, and she says that but lycopodium 200 is a wicked in that higher scale. So please careful in using lycopodium. But lycopodium 30 and lower potencies are not so injurious, but lycopodium 200 and above is always do some mischievous activity when prescribed in higher scale. So she gives a caution mark here also. Then in case Dr. Boyd is a great scientist, and he was homeopath also, and he has got given the Materia Medica. Boyd's Materia Medica is there, where he says using lycopodium in higher than the 12C in cases of the duodenal ulcers, they may cause perforation. So Dr. Boyd has observed that using medium to higher potency in case of duodenal ulcer, they causes perforation. So Dr. Boyd has said use lower potencies in case of duodenal ulcer and peptic ulcer like that. So this has been advice given by Dr. Boyd. And then again about the phosphorus remedy, it is very dangerous to use phosphorus in higher potencies to a patient with advanced physis, and they may lead to hemorrhage. So, this has been advised by many masters, including Dr. Taylor, Boyd, and other masters also, Herring also. So it is whenever we use phosphorus in case of physis, then we have to be very careful, because they may tend to cause hemorrhage. So we have to be very careful with phosphorus 200 and above. So that is also been caution mark given to us. Then again, another important aspect is phosphorus, silicea, lacasis. All three together. Dr. Hubert, he says, whenever phosphorus, silicea, and lacasis, these are the three dangerous remedy in case of tubercular diathesis. So Dr. Hubert has said, wherever there is a tubercular diathesis or tubercular tendencies have been observed, too higher frequency or too frequent repetition of these remedies, phosphorus, silicea, and lacasis, they drive the patient into active tuberculosis. Dr. Hubert says that if you use phosphorus, lacasis, and silicea in higher potencies, particularly in tuberculosis tendency or diathesis, they may tend to active tuberculosis. So we have to be very careful in this time. So our masters have said that care must be taken, adequate care must be taken when we use sharp weapons. I mean sharp weapon means just like phosphorus 200, silicea 200, lacasis 200, lycopodium 200. These are the sharp weapons when we use. So our masters have always been very careful to hint us and observe care in prescription of this large potency in certain circumstances or certain cases. So these are the deep acting remedies which I have listed, like phosphorus, silicea, lycopodium. So with the deep acting remedies, we have to be very careful in using higher potencies. So with this, I have completed the entire sequence of the potency selection process. I have guided you all the things from the beginning, 3 classes, from the susceptibility of patient, from the talking about the susceptibility of patient, talking about the age, talking about the sex, points related to habits and environment. Then I have talked about the constitution and selection of potencies, temperaments. Then I have talked about the sensitivity, sensitive patient and non-sensitive patient. Then I have talked about how selection about the mental symptom, when there is a predominance of mental symptoms, when there is a greater match of characteristic symptoms like PQRS, then nature of the disease, then particularly with reference to acute disease and chronic disease, and incurable diseases, then seat of the disease, and then previous treatment taken, and they come to us. Then pathological stages, dynamic pathology and organic pathology, and finally different miasmatic state, and with reference to medicine like nosodes and certain medicine which when used in varying potencies, and prescription in case of a deep acting remedy. So much wide points have been given to you in selection of remedies, and with this we come to conclusion of the chapter selection of potency. So hope the 3 sessions, last 3 sessions in this will be enlightening to you in selection of potency. So once we understand the selection of potency through these parameters, what I have given is the masters are given. I mean the word is not I means our pioneers of homeopathy from Dr. Hahnemann till date, all the masters, they have given their observations, they have given their own claims and their confirmations over a period of time. All the confirmations and claims have been listed down in our organon and verified. So I have given all verified propositions which have been given by masters in selection of potency. Over to Dr. Anup and Dr. Murthy.
Thank you, sir. Thank you, sir.
Thank-
Suresh Kumar, thank you very nicely. You have given the potency and everything. Any doubts, sir? If no doubt is there, we can close. Any doubts? So, Anup Kumar, sir, shall we
I think we
close?
can wind it up, Suresh.
Okay, thank you, sir.
So,
Thank you.
Yeah, I thank everybody for the patient hearing and participation.
Thank you, sir.
We will meet next week. Thank you very much.
Thank you. Thank you.
Thank you.
Okay, sir. Thank you.
Thank you all, sir.